No, this topic is so important because it's just the rat race topic where we have the surgery that was done by vascular, and we got as much flow as we can, but it only goes to the ankle. And we have the wound that's not healing. And unfortunately, the longer that wound stays open, then we end up with more surgical intervention. And, what is the end game with these patients? It's a really frustrating problem to have. And I think one of the most interesting things that I've heard from last year's conference was listening to some of the vascular surgeons who are doing these pedal arch access points and intervention. They were as podiatrists when we don't have enough circulation to heal these wounds.
Yeah, when I was first looking at this topic, when I was first given it, I found it my first thought as a podiatrist who deals a lot with when I was in Texas, there were a couple of vascular surgeons who were doing the pedal artery angioplasty, and given where they start, it's pretty encouraging evidence for this as far as improving outcomes, at least getting them to the point of healing the ulcer, increasing those ulcer-free days, reducing the risk of infection, amputation, because unfortunately, as we know, when a lot of these patients, they lose their leg, it unfortunately can become a death sentence for them. So some great material out there.
No, to have absolutely. An endovascular surgeon or an endovascular provider in every facility that could do pedal artery angioplasty would be amazing. It really is, what skills are available in the facilities in which we all practice. And it's been great seeing all of this technology come together where people are able to move forward with these kinds of skills. It's very hopeful.
Rose, can I add to that a little bit?
Absolutely.
This is definitely an area where referral to your quaternary care center, if you don't have that endovascular specialist, identifying that person and making sure you get the people to the right specialist and in the right hands becomes very important. Because, even though these interventions or a distal bypass may not last, for a long time, and they certainly do go down, or procedures may need to be repeated, etc. Frequently, if you can get enough perfusion, it'll give you time for wound healing. Right. Once they're healed, then it's maintaining that tissue integrity, getting the appropriate offloading, etc. But making sure that you have that person in your corner, even if it's not the person you have to use every time. But I think that's really a key thing, is having that talented team that you can refer to when necessary.
Right. I completely agree. Absolutely. Well said.
Yeah, I agree, and especially with perfusion, I think it's important if we if we only get the blood flow down to the ankle level, and hoping that some of the collateral will help heal the wound. If we can get a TCPO2 or STP test done around the wound to see if there's actually adequate perfusion to the wound to heal the wound, is actually very important, because it's going to be collateral for sure, and the question is how much perfusion is getting there. And unfortunately, not every facility has those advanced testing, and it may be difficult, sometimes to get the patient those appropriate tests they need, which is definitely access to the correct tests and stuff is also an issue we have, depending on where you're at.
I think, unfortunately, that ends up resulting in a lot of more amputations than potentially necessary.
Absolutely. I agree. Because you can do the full workup, right? We can do the full workup. We can do the TCPO2s. We can do the pulse volume recordings, all of those things. And at the end point, and vascular helping as much as they can. And if you just don't have someone that can do that type of procedure to get that kind of perfusion at that distal of an area, there's just nothing else that can be done.
That can be done.
I completely agree. I think the biggest struggle is finding someone that can do those distal procedures for you to get enough blood flow for wound healing. So I completely agree with everything what you guys have said so far. It's difficult when we do everything we can, but there's just not an option to do anything that distal to be able to get that wound healing. And then that's kind of when, at least at my hospital, we start discussing the palliative care, just because there's no other options.
I think it's important to get counseling for patients, like, especially with smoking cessation and diet modification. There's so many patients that vascular just do all this hard work on, angioplasty or bypass, and then they smoke the next day.
Yeah.
Yeah.
You my foot. And like, why don't you quit?
I know.
That's patient, selection, and telling them realistically, you need to be a big part of this as well. You can't just put it all on us. You have to meet us halfway. You have to make changes to your lifestyle if you want to save this limb or whatever. You know what I tell all my patients? You have to meet me halfway.
That's great.
Dr. Shishpur.
I was going to just make a comment and also ask a question, because this is such an important topic, and I'm very passionate about this, as you may know. That's why I love the podiatrists, because I really truly believe that they are the gatekeepers in saving the patient's limb, because at the end of the day, they send the patient for revascularization, the patient goes back to them. So I'm so glad that most podiatrists, if not all, now understand these issues, that yes, we can go below the malleolar, we can go to the foot, we can do pedal arch reconstruction, we can do complex procedures, and that's so important. And I've always emphasized that please look at the angiogram if you can, or at least read the report, see what was opened, what was revascularized. Don't just rely on the patient or somebody telling you, oh, I did the revascularization, is good. Get some additional testing if necessary. So I love hearing all this that you guys are saying, and thank you so much. My question to you is that if I'm an interventionalist and I have dedicated my career in learning how to work in those pedal arteries, working below the ankle, but I'm having a hard time meeting the podiatrist and letting him know that, listen, I'm dedicated, I want to do this work. What is your advice in regards to folks like me that are not podiatrists, that do revascularization and want to learn how to get in touch with podiatrists and let them know what they can offer? What do you recommend? Rosemary, maybe you can answer. And then
sorry.
Oh, no, that's okay. Go ahead, Rose.
No, please go ahead, Rosemary.
No, I was just going to say, any big platform, AGFAS, the American College of Foot and Ankle Surgeons, the American Podiatric Medical Association, all of these organizations are such a big blanket with hundreds of podiatrists and foot and ankle surgeons that are members. And so a lot of the podiatrists stay very well linked to those organizations, which is the APMA and AGFAS. So that would be one great place to either, be a lecturer and inform a huge amount of group of podiatrists across the country at the same time.
So another recommendation.
That's great. Sorry, go ahead.
You're, like you say, that you're one of the few interventionists that can actually go below the inframalleolar, and you want to get that out to the podiatrist. Like every county, every area, they're actually a podiatry association associated with it. If you can find out and email them, they can actually send a mass email out to all the podiatrists in the area, in the private community. Because if you're in the hospital, it's easy because we know what the vascular surgeon can do, but it's the private world that we need to let them know that I'm here. Send them to me. I can do this. If you just go out and try to look up your local podiatry chapter or association, it will pop up in your county. Email them, and they can email all the members that, oh, we have a new vascular surgeon or interventionist here who can do X, Y, and Z procedure. Keep them in mind if your patient needs them in the future. And this one way to get your name out and to help let the reach out to the private world so they know that there's someone in the community that can do this procedure.
No, that's great. Obviously, a very important topic, and you're going to get a lot of passion from a lot of podiatrists, because that is something that we really struggle with, and also we love to hear and get that help and that input.